I'm Veronica O'Brien. I'm here today with Dr. Lauren Eberly, who spearheaded the MUTTON-HF trial. She's currently an assistant professor at the University of Pennsylvania, and she's a staff cardiologist at the Gallup Indian Medical Center. Can you tell us a little bit about your study?
Yeah, thank you so much for having us. So I think first it's just important to note as a little bit of background that due to the enduring impacts of settler colonialism, we have very high rates of food insecurity, which really drives poor cardiovascular health and poor health outcomes among many Indigenous populations. And there's also this excitement and focus and momentum in Native communities to reclaim traditional pre-contact foods to improve health. So within that context, in partnership with community members, we designed MUTTON-HF, which is a locally sourced, culturally and medically tailored meal program that incorporates local traditional Navajo foods and recipes. So the MUTTON-HF study, which we presented today, was designed to test the hypothesis that this Indigenous, culturally medically tailored meal program would lead to a lower incidence of hospitalizations and ER visits among patients with heart failure in rural Navajo Nation.
Awesome, thank you. So how can this actually be generalized to other populations?
Yeah, it's a great question. I think, we were really excited to see some of the results, and we showed that our primary outcome of interest, which was the proportion of patients with hospitalization or ER visit at 90 days, was significantly lower for those that received the meal program, as well as heart failure hospitalizations in general. And then a lot of patient-reported outcomes were also really favorable, which was great to see, including KCCQ, measures of food security, financial strain, as well as weight and blood pressure. And so I think, there are aspects of this intervention that are certainly specific, but there are some core components that are generalizable to your question. And when we think about those things that our community engaged design is one of them, building strong partnerships and alliances, partnering with local food systems to really lift up community members, culturally relevant meals, as well as partnerships with community health representatives. All of those I think are really relevant across geographic and cultural contexts. And I think this model really could be adapted and expanded to other communities to really align with their own, culinary needs and the strengths of their community to improve health in those communities.
What's the game plan to make this into a long-term solution?
Yeah, I think that this is the first step for us on hopefully a long-term, path to really become a sustainable part of healthcare. So we hope that this effectiveness trial will soon be followed by an economic evaluation to look at the cost savings and cost effectiveness of this program. And with those two, we're really going to hopefully use this to advocate for payers and health systems to pay for this as part of healthcare, because it really is making meaningful difference in patients' lives and in the community.
Right. You're doing some great work, Dr. Eberly. It was really nice connecting with you today, and I look forward to seeing the rest of your research in the future.
Thank you so much for having me.